Hello and welcome to Dana-Farber Cancer Institute's funding announcement webinar for our 2021 Determination of Need Access to Services Grant Opportunity. My name is Magnolia Contreras and I am Vice President of Community Health. Dana-Farber Cancer Institute is a leader in adult and pediatric cancer treatment and research, and our mission is to provide expert, compassionate care to adults and children with cancer while advancing the understanding, the prevention, diagnosis, treatment, and cure. Dana-Farber's Community Benefits Office has as its mission a focus on ensuring that patients from diverse backgrounds receive equitable cancer care and treatment. Our office establishes quantifiable, evidence-based, and sustainable initiatives in cancer prevention, focusing on at-risk, underserved, and diverse populations. And we do this through the strong and long-standing partnerships we have in the community. Earlier this year, Dana-Farber opened a new oncology services facility in Newton, Massachusetts, after receiving Department of Public Health approval. As a result of this Determination of Need funding opportunity, Dana-Farber will provide approximately $4 million over the next 4 years to address our health priority of access to services. Our vision is to ensure that all Greater Boston residents have access to coordinated and equitable health and support services, particularly those impacted by cancer and other chronic conditions. Now, I will turn it over to my colleague, Jennifer Lee, from Health Resources in Action, who Dana-Farber has contracted to administer and facilitate this grant-making process. She will talk about the key components of the request for proposals, including information on how you can apply and by when. Jen?
Thank you so much, Magnolia, and hello, everyone. We're so pleased to share with you more information about the Access to Services funding opportunity, including how to apply. Here is a high-level agenda of the core components that I'll be walking through today with you on this presentation. In addition to providing a high-level overview of this funding opportunity, we'll also be grounding you all with some key definitions and frameworks, which we hope will be helpful as you're considering whether to submit an application or not. I'll walk through specific types of available grants that we have through Dana-Farber's Determination of Need grant program, including how to apply and key deadlines. Now, as Magnolia shared earlier, we wanted to underscore and reiterate the overall goal of the Access to Services grant program. That is to ensure that all Greater Boston residents have access to coordinated and equitable health and support services, particularly those impacted by cancer and other chronic conditions. Ultimately, our hope is to support upstream approaches to reduce cancer burden with the ultimate goal of addressing needs across the cancer spectrum. These include in culturally competent cancer prevention, screening and care, and survivorship. Now, Dana-Farber is offering 2 particular types of grants that you can apply for in this year. The first is community clinical linkages, and these are defined as approaches that help connect a range of different entities, including healthcare providers, community organizations, and public health agencies so that they can collectively improve residents' access to health and support services, including prevention and chronic care services. The second grant opportunity that's available is known as the systems level grants. These will look to support policy, systems, and environmental, also known as PSC change approaches that sustain long-lasting change within communities and help ensure that healthy choices are practical and available to all residents. I'm going to spend the next few slides delving a little bit deeper into PSC change and some frameworks that are really helpful in understanding PSC change, as they really make up the crux of this funding opportunity by Dana-Farber. So the P in PSC change stands for policy change, and included within policy change options include any law, regulation, procedure, administrative action, incentives, or voluntary practices that are promoted or produced by government entities or other institutions. The S in PSC change stands for systems change. These include those that impact all elements, including the social norms of entities at varying levels, including at an organizational level, an institutional level, or a systems level. And finally, the E in PSE change stands for environmental change. Those include approaches that make an impact on the physical, social, or economic environment. And we share this slide with you to reinforce the models around PSE change as you think about what particular leverage you might want to mobilize or have an impact on your particular approach, and that you would include in an application. You're welcome to submit an approach that includes any realm within just the P or the S or the E, or any more of these particular changes listed here. This next slide, as adapted from the Mass in Motion initiative, statewide collaborative in Massachusetts, helps to also further depict what PSE change is, and to also distinguish it from what are commonly known as programs approaches. We want to highlight and underscore here that programs approaches are incredibly vital and important in our local communities, and we're not looking to diminish the important value of programs approaches moving forward, but rather just to reiterate and underscore that through this particular funding opportunity, Dana-Farber is most interested in investing in those PSE change approaches that may be reflected on the right-hand side of this chart. And the other thing to mention is that this chart is mainly for example purposes. They're meant to illustrate some models as you think about distinguishing between programs versus PSE change approaches, and how you can apply them towards a particular approach specific to populations impacted by cancer burden. So in this chart, the first example is hosting a community bike ride, a terrific one-time programs approach or event that happens throughout communities across the country, and again, that we very much support. But pushing this towards a PSE change approach differently might look like implementing a complete streets policy that ensures that community roads are designed safely and accessibly for all users to use, much beyond just a one-time event, and sort of at any time of any given year. A second example in this chart, as highlighted, is having an open gym night at a local school. Again, a terrific event that happens in many communities and which are supported. But ultimately pushing that towards a PSE change model might look like implementing what is a town-wide joint use agreement, so that residents of any community have access to the gym or other parts of a school when school is not in session. So again, just some helpful frameworks, hopefully, that really further describe what PSE change may look like and how you might apply that to your particular approach. Now, the field really identifies PSE change approaches as those that have the strongest potential to address and affect inequities that exist in our communities. We define health inequities as those differences experienced by a group or population that are unnecessary and avoidable, but are also unfair and unjust. And in 2019, Dana-Farber, in partnership with Boston Medical Center, conducted a cancer-focused community health needs assessment that highlighted a number of key takeaways listed on this slide. The report really highlighted that some populations experience inequities and are disproportionately burdened by cancer more than others. Some of the key recommendations from this report include the following: that cancer is the leading cause of death in Boston. Cancer mortality rates also differ by race and ethnicity, gender, and neighborhood as just some demographics. Disparities in cancer incident rates still exist, although incidence rates overall have declined over time, which is a positive sign of progress. And unmet health-related social needs, those social determinants of health that we often hear about, including housing stability, employment issues, food insecurity, and financial hardships, are challenging in their own right. But when you really add them and combine them with illnesses and chronic conditions such as cancer, they really have a tremendous and devastating impact on individuals, both from a health perspective, of course, as well as around cost areas. So as we think about health inequities and in the field of cancer care, it is also important to consider how to address root causes. Ultimately, by addressing root causes and using policy systems and environmental change approaches, can we feel that we can ultimately have transformative change in our populations? And again, this is a space where Dana-Farber is interested in funding through the Access to Services RFP. So this tree helps to further define and help visualize how to address health inequities by addressing root causes. In this visual, what you'll see on the leaves of the tree are a range of different health outcomes, and typically negative health outcomes. Cancer is reflected here, as well as COPD, diabetes, asthma, depression as just some examples. Oftentimes, it's thought that these negative health outcomes are affected by individual health behaviors, which are reflected on the branches, things like smoking and diet and substance use. Oftentimes you might hear, oh, if only someone could eat better or didn't smoke or was less stressed out. But what we also know is that those individual behaviors as reflected on the branches are really enabled by what's on the trunk of the tree. These are ultimately social determinants of health and include things like built environment, education, violence and trauma, employment, housing, and social environment. The trunk of the tree really enables what the individual behaviors we see are on in terms of the branches. Ultimately, though, Dana-Farber is really seeking to push down as much into and under the ground of this visual towards the root causes. Those ultimately include the isms of our society and root causes of health that ultimately manifest themselves up into the leaves. These include aspects like racism, ableism, sexism, ageism, etc., as well as structural and institutional barriers, distribution of resources. We want to underscore that by truly drilling down to root causes, can we hope to ultimately have an impact on health inequities, particularly among those affected by cancer. And we are seeking to support those particular approaches through this funding opportunity. We also want to add on this next slide a key set of guiding questions that have been adapted by the Massachusetts Department of Public Health that also offers some concrete and helpful ways of thinking about and asking important questions whenever considering whether a particular idea or approach addresses an inequity. These 4 key questions are: who benefits, who is harmed, who influences, and who decides. And we recommend and encourage that applicants also apply this particular framework as they're developing their approach. Finally, one key and critical additional component of addressing health inequities is the importance of community engagement. And that is defined by ensuring that individuals directly affected are engaged, whether it be through the designing, the implementing, or an evaluation of a particular approach. And in this case, particularly those impacted by cancer and other chronic conditions. Now, the access to services bucket or realm of work that Dana-Farber is looking to support is vast and includes a number of different areas. We encourage you to look at the request for proposals for more detail, as well as examples about what access to services covers. We also wanted to share this list of proposed outcomes that applicants will be asked to identify within their application which one or more of these outcomes they are looking to address, and that Dana-Farber is seeking to support through its funding. This list of outcomes includes the following: increased access to care, increased preventative care, increased continuity of care, increased patient knowledge, increased healthy behaviors, improvements in system and organization practices, and policy change. Now I want to shift now to some more nuts and bolts of this funding opportunity. First, starting off with who can apply. Dana-Farber seeks to support Massachusetts-based nonprofit community organizations and partnerships. Applicants must have sort of an identified primary lead organization that does the applying process and has a 501c3 status or a fiscal sponsor with that particular tax-exempt designation. Dana-Farber seeks to give preference to organizations that are serving its priority neighborhoods, and these include Roxbury, Dorchester, Mission Hill, Mattapan, and Jamaica Plain, but applications are also welcome from other Greater Boston communities. Applications are also welcomed from organizations serving residents in the city of Newton, whereas Magnolia mentioned where the new facility is located. A little bit more about who can apply. Dana-Farber really welcomes through this funding opportunity applications from organizations that either already work with the institution or also to develop new relationships with other organizations. And this includes those groups or entities that work not just with individuals who already have a cancer diagnosis, as well as those who are not already connected with Dana-Farber itself or any of its local clinics. In terms of who cannot apply, these include the following entities or types of approaches: individuals, for-profit entities, projects that are strictly for research purposes, as well as clinical trials. And I want to share again the slide which talked about the 2 types of grants. And on the following slides, I will be talking about each of these grant opportunities in turn. But just to reground us in the 2 opportunities that are available for funding. community clinical linkages, and systems level grants. First, for community clinical linkage grants, the way that these grants are set up include in terms of time duration, a single year of funding or over a 12-month period, and in terms of funding amount, anywhere up to $50,000. These grants are specifically seeking to support smaller or pilot initiatives that develop and enhance connections between community and clinical sectors with the goal of improving population health. We want to share that a limited number of awards out of Dana-Farber's entire determination of need strategy will be designated for this particular track. Shifting to systems level grants, these are shaped differently. They are meant to be multi-year funding for anywhere up to 4 years in terms of time duration, and in terms of monetary amount are available for up to $200,000 per year. Systems level grants are intended to support initiatives that are policy systems and environmental, again, PSC change approaches, ultimately ones that support upstream efforts. Upstream efforts are defined as those that focus on improving social and economic structures in order to decrease barriers and improve supports that allow people to achieve their full health potential. We want to share here that the bulk or vast majority of the funds that Dana-Farber has available to provide will support these types of grants. Now, a little bit more about systems level grants. There are 2 options that applicants can pick from in terms of the setup of these types of grants. The first option includes a planning period followed by multi-year implementation grants, or the other option, option B, is to simply go with multi-year implementation grants as your overall sort of time, duration, or setup or format. We define each of these on this slide here. A planning period is defined as any time period up to 1 year and really allows an organization to essentially build a foundation upon which they will carry out subsequent or future implementation activities. Some examples might include, you might use a planning period to learn information or gather information, assess the landscape to inform a broader process, and or develop relationships. Maybe it's a network or a coalition that you plan to build, and to use the time to build those relationships for that. A multi-year implementation grant or setup, however, is useful for groups or initiatives that are already up and running and developed at the time that they're applying for funding, and they will use these resources if they're awarded a grant to really further an existing approach or agenda and take it to the next level. On this slide, we share the types of allowable expenses under this Dana-Farber funding opportunity. These include staff or personnel compensation, including taxes and fringe benefits, subcontractor expenses. So if you wish to partner and subcontract some of the funding out to another entity to help you carry out goals and vision and activities, that is allowable, as well as stipends for community members. Operating expenses are also allowable and include things like office supplies, equipment, copying and printing, telephone and fax, postage and delivery, program advertising, staff travel, training and education supplies, staff training and evaluation. Now, Dana-Farber wanted to offer a range of different ways in which you could submit your application for the Access to Services RFP. There are 3 ways, and we encourage you to select one of these 3 following methods of submitting your application. The first, what is probably most commonly known, is a written narrative or document. The second is a video, and included within that is some type of oral presentation about your idea or your approach. And thirdly, we can offer that applicants can submit a slide presentation like a PowerPoint format. Now, on this chart here, we wanted to outline the total sort of maximums that you cannot exceed given the type of grant application that you want to submit, either community clinical linkage grants or systems level grants, and then the format that you want, again, either if it's written, video, or slides. So this chart depicts what those maximums are, all told or in totality, how much sort of length or minutes you have, and that we encourage that you not exceed. So for community clinical linkage grants, if you want to submit a written proposal that's no more than 5 pages, 12 size font, and 1-inch margins. For a video, it's no more than 15 minutes. And for slides, it's no more than 25 slides. For a systems level grant, and on the next slide, I will explain a little bit further about this particular 2-stage process. If it's written no more than 3 pages, again, 12 size font and 1-inch margins, video 10 minutes, slides 15 slides. Now, each of these grants has two different types of processes or sort of different numbers of processes. Community clinical linkage grants will be a one-step process. You would simply submit a full proposal and we will make a decision on that. Systems level grants, however, will be a two-step process. We will ask all organizations interested to submit a full letter of, submit a letter of intent for this particular grant program. And if you are invited, you will then be asked to submit a second stage that would be a full proposal for systems level grants. Now, I'll just briefly walk through the questions we'll be asking you depending on the type of grant you are looking to apply for. Under community clinical linkage grants, there are a range of different questions we're interested in hearing from you on. And I want to flag that in red font at the bottom of the slide, we've highlighted that there are some questions we've put a star or asterisk next to. These are the questions that we encourage you to spend most of your application talking about. We care about all of these questions, but we probably are looking to emphasize and hear more about those questions that have the star. We set the maximums that you saw on the chart in the previous slide, but aside from that, we really did not want to be overly prescriptive about how much space or how many characters or words you use. You know how much total you have to use and you know which questions we care the most about, and the rest is really up to you. So the questions are the following. Who are you? This includes what is your organization's mission and structure? Describe your project team, including their roles and responsibilities and past experience in this work. The second question is really honing in on what is your population? Please describe the demographics of your population and experience working with them. What inequities and access to services to support cancer care do they experience? And what influences and causes them? And then thirdly, what will you do? What is the vision of your overall approach? And what are your specific goals, activities, and timeframes? Also included in this question are two optional questions. We ask you to pick one of them depending on which applies to you. If this is a new initiative and you've already thought about evaluation, how will you know if you have been successful? And if this is an initiative that has already been underway, are there any results and outcomes so far? How will this funding address the next phase of work? A few more questions to answer for community clinical linkage grants. Who will you work with? This includes what new and existing partners will join you and what will their roles and responsibilities be? How will you engage those affected by cancer? And this includes how will you actively engage individuals and communities affected by cancer in implementing your approach? And finally, what are your strengths and challenges? What do you consider to be the greatest strength of this proposal, as well as the greatest challenges and or concerns? For community clinical linkage grants, you will be asked to submit the following attachments: a project budget for which a template will be provided, the lead applicant's organizational budget from your most recent fiscal year. We're essentially interested in a statement that includes your revenue and expenses, and also verification of the lead applicant's 501c3 status or that of a fiscal agent. Now, just briefly to share with you the questions that are the systems level grants, and you recall I said that systems level grants are a two-step process. These are the questions that are only required of that first round. If you are invited to submit a full proposal, we will share with you the additional questions as well as the list of attachments at a later point. It's a similar process in terms of the maximum amount of space we are requiring or requesting. And you also know, based on the asterisk with this question, number 3, that we're most interested in that, and the rest is up to you. So the questions include, who are you? This includes, what is your organization's mission and structure? Describe your project team, including their roles and responsibilities and past experience in this work. The second question involves, what is your population? Please describe the populations that will be most affected by your proposed initiative, including examples like demographic information, cancer risk, neighborhoods of residents as well. And what is your experience working and partnering with them? And then thirdly, what is your idea? What is your vision for a PSC change approach that you are proposing? How will it address the root causes of the inequities experienced by the populations you seek to support? And which proposed outcomes do you hope to achieve? Just a few more slides to cover with you. We wanted to share on behalf of Dana-Farber as well some of the key criteria that will be used by the review committee when reviewing all of the applications. So you have this in mind as you're developing your application. The following 5 criteria will really be elevated and prioritized, and these include addressing inequities, whether the approach addresses a population that experiences higher rates of inequities and cancer burden, A second criteria will be whether an approach is community driven. Does it actually engage and actively engage individuals affected by cancer in a particular approach? Thirdly is impact, whether the intended outcomes address root causes of inequities as well as social determinants of health. Fourthly is feasibility. What is the likelihood of success of this work as proposed and the ability of the applicant to carry out change? Lastly, sustainability. What is the likelihood of long-term impact beyond the grant cycle that Dana-Farber will support? We finally wanted to offer you a look at sort of the evaluation and capacity building approach that Dana-Farber plans to conduct. It will have an evaluator that will work collaboratively with grantees to establish an evaluation approach that's centered on equity. It will also focus on collecting action-oriented data that's relevant across the entirety of the portfolio of the awards and grantees that are supported. Finally, Dana-Farber looks to host collaborative sessions focused on evaluation learning and other technical assistance that allows the awardees and the grantees to do peer sharing and to really build their infrastructure beyond the life cycle of the grant. We wanted to share some key deadlines as reflected in this chart here, and it's divided by each of the key steps as well as which particular grant program you are applying for. So if you are applying for the community clinical linkage grants, your full proposals will be due Tuesday, June 15th, 2021 at 5 p.m. If you're applying for systems level grants, because those involve a few different steps, your letters of intent will be due on Tuesday, June 8th, 2021 at 5 p.m. You will be notified if you are invited to submit a full proposal on Tuesday, June 29th. And the full proposals, if you are invited to submit them, are due on Monday, July 26, 2021 at 5 p.m. We plan to notify organizations whether they are funded or not by the end of August. And finally, we wanted to share just a few other ways in which you can ask questions or get answers to the questions you might have. We are planning on hosting a drop-in optional Q&A session on Monday, May 24th from 11 a.m. to noon. And we will have posted that particular registration link on Dana-Farber's webpage. We wanted to share the contact information for Becca Walmer, Senior Community Outreach Specialist at Dana-Farber Cancer Institute, who will be able to field any questions that you may have as you're putting together your proposal. And finally, we will post on Dana-Farber's webpage a frequently asked questions document over the course of these next few weeks as we gather those questions and provide responses to the inquiries that you have. We want to thank you for staying and hearing about a lot of information about the Access to Services grant program and RFP being offered by Dana-Farber Cancer Institute. Thank you for your time. We hope that this provided a lot of helpful information, and we look forward to receiving your applications in the near future. Thank you and have a great day.